You are listening to the HealthManagement.org podcast series. Professor Geraldine McGinty talks about why diversity is so important in healthcare leadership.
When we're talking about novelty versus legacy, I'm a radiologist and, we have innovation in our DNA. We thrive on technological innovation, but the term novelty in English actually has sort of a negative connotation, something that's not lasting, something that's not serious. And the idea that we would think about diversity, which is what I'd like to talk about as a novelty, I think is not necessarily where I'd like to position it, because the fact that we are even considering diversity as an innovation is really a sign of our failure as a healthcare system. And I wrote this piece after seeing one more, we'll call them manel, where there were no people of color and no women in a discussion around the future of healthcare. And when we look at the healthcare workforce, women are significantly overrepresented. And in most countries, especially in the US, the diversity of the healthcare workforce outpaces the diversity of the population they serve. And yet when we look at leadership, it is very rarely reflective of the communities served. Now we know there's ample evidence, largely in the business literature, that diverse teams outperform. We also know that a healthcare workforce that more closely reflects the population it serves actually drives better healthcare outcomes. So there's ample reason that we need to do this. Also, groupthink can really be fatal, frankly. I think we've seen examples of that in the business literature with the Challenger disaster, but we also have seen, I think, some decisions, certainly I'm going to say it here in the US, where we had people hewing around a particular political ideology that have really cost lives. So I think I'm anxious that we think about diversity not as a novelty, but as an investment in the future performance of our healthcare system. I will just say one more thing, which is that we cannot be performative when it comes to diversity and inclusion in healthcare. We can't just pluck people and put them in leadership so that we can tick a box around diversity, because it's not just diversity of the team, it is how empowered each member of the team feels. So how do we do that when, you're coming in perhaps as a first person of color or a woman or a person from a sexual minority? How do we make sure that you feel empowered to bring your voice and your unique perspective and lived experience? Well, that's where I think it's so important to institute mentorship programs and really make sure that the conversations are inclusive.